Dr. Hotez, he is responsible, not for the fact that coronavirus exists, but for the fact that David Brooks articulates that we had one mission. Once it got here, the president's mission was to model life-saving behavior, to support the governors in testing and contact tracing and surging supplies to states in crisis. He did none of that. And I suppose it amounts to good news that in month 4, the governor of your state, the governor of Texas, has decided that masks might be a good idea after all. But how did we get here?
Well, there's no real good news, Nicolle. We've had this now massive resurgence of COVID-19 in the United States, mainly focused in the southern U.S. We were at 40,000 cases last week. That was 10,000 cases, 5 to 10,000 cases more than our peak back in April and May. Now, in the early part of this week, 50,000. Now we're headed to 60,000, and Dr. Fauci has predicted we'll soon get to 100,000. If you look at if you extrapolate times the populations of Texas, Arizona, and Florida, we're already there. So we have this steep acceleration in the number of cases. It's being paralleled by hospital admissions, intensive care unit admissions. The positivity rate is going up. So this is a terrible public health crisis that we're now facing. And we still, as far as I can tell, do not seem to have any national plan or roadmap for what to do. It's still business as usual. Let the states decide. The federal government and the task force will ensure that we have adequate supplies and supply chain management for and masks and other measures, but there is no federal plan or roadmap of how to take this on. And of course, and if you listen to the messages out of the White House, there's not even recognition that this is a serious problem. There are still the deflections that we're hearing about. China's to blame as the Chinese Communist Party. There is no plan, there is no roadmap, and we need to now take some substantive action to chart a new course for the country. Otherwise, the number of cases, hospitalizations, permanent injuries, even deaths will continue to skyrocket.
Dr. Hotez, is there a single country that has managed to bend their curve without those things you just detailed, a national strategy, a national capacity to surge supplies, national standards for social distancing and mask wearing, national testing regimen, national contact tracing programs? Is there any country on the planet that has bent their curve or beaten COVID without those things?
Not that I'm aware of, Nicolle. You know, this is hard work to turn this virus around, especially if you're doing it without a vaccine. It's like trying to fight with one hand tied behind your back. So you need the full force, the full power of a country's national government, federal government, to take this on. And that's what we need now. We need the full force of the CDC out front, leading this, telling the governors what needs to be done, and giving the governors some cover, because they're taking a lot of political flack from their left and their right, and making decisions often based on that. We need now very concrete, clear-cut federal guidance, help with all the things that we need, like syndromic surveillance and contact tracing. At this point, now things are getting so out of hand, I'm not even certain that just wearing masks alone and the other measures being proposed are going to be adequate. We may have to move back into lockdown in some states, or maybe a full national lockdown as well to contain this. It's getting that bad.
Carol Leonnig, I think what you're reporting underscores is that not only are we lacking all those measures that would protect people, that would help us defeat the pandemic at a national level instead of this hodgepodge, but the vice president and president aren't even interested in protecting the men and women who would take a bullet for them. I mean, what you're reporting sort of leaves you sort of trying to process is that the Secret Service, they're the men and women responsible for protecting the lives of the president and vice president. There aren't enough of them because they are falling sick with COVID. These are the closest physical people, other than their families, to the president and vice president, and we don't have enough of these men and women because of COVID. I mean, what is the response from Secret Service to the fact that they can't staff the vice president?
Well, they're in a horrible place, Nicolle, an absolutely horrible place, because they're never going to rat on the boss / complain about the boss, which is the president, and in this case, the vice president. But you're absolutely right to bring up the analogy of some people who would take a bullet. That's the kind of patriot we're talking about when we're talking about a Secret Service agent. Will literally be trained to jump in front of a bullet on its way to a person that they're protecting, the president especially, but also the vice president. And here, the president and the vice president have put these people in harm's way, and to be honest, without real necessity. You know, it's different when, you know, we're at war
Right.
or we're in real crisis, but to go out and do a public event so that you can say you care about coronavirus is not the best, probably, way in the Secret Service agent's view to, not the best reason to put their health and the health of their families and their children at risk. The other thing that sort of stunned me about this, Nicolle, and the reporting that Josh Dawsey and I did was that the Secret Service was warning Pence and his staff, we can't do it because we have to get healthier agents in place. These people are too sick. We need to wait. And instead of saying, you know what, these people are getting sick, maybe we won't go, they said, okay, cool, we'll go. That is sort of like, again, a warning sign, because in Tulsa on June 20th, Secret Service agents who were doing advance work for the president got sick. Then Secret Service agents in Arizona got sick. Well, guess what? I'm going to predict we're going to have a story about South Dakota pretty soon.
Yeah, and Jonathan Lemire, let's talk about this trip. It seems to represent this sort of ugly braid of everything going on in the country. No masks, no social distancing, the president putting the Secret Service and the reporters and everybody else who has to travel just to move a president. It's literally thousands of people that have to get on planes and in cars and relocate just to move a president around physically. But there's also more than an undercurrent of the other side of the tensions and upheaval in this country. Talk about the fraught trip today.
Yes, Nicolle, it is. The timing of this is, of course, far more significant than just the fact that it's July 3rd, but of what the moment we have in the country right now. First, to your first point, yes, there's no question. It's thousands of people who are put in play and, frankly, in harm's risk to move a president. As you well know, and I know, I mean, I could speak to the Arizona trip just a week or so ago. You know, the number of staffers who travel with the president on the plane, the teams that are on the ground to meet us at the airport. You know, we had a couple of different stops that day, culminating in that mega church rally. And I will note the press pool, the 13 or so of us who traveled with the president, we were the only ones in that church wearing masks. No one else was. And I suspect it'll be a similar scene tonight in South Dakota. The governor of South Dakota, a Trump ally, has said that social distancing will not be required, asking, of course, the people, if they are sick, to not come out, saying masks are optional. But there's no way to sort of enforce that. There are no plans for temperature checks or anything of that nation, or anything of that nature, nor testing for people who are coming in and out of this rally. And there's more than 7,000 people expected to attend. And of course, also, you know, Mount Rushmore is a great patriotic monument, of course, but it's also, questions have really been raised about Thomas Jefferson in particular, but also George Washington for their holdings of slaves when they were alive, and how that comes in a moment where we're reevaluating statues across this nation, Confederate generals in particular, but also founding fathers, and what that means. And of course, for the president, this is his attempt to take advantage of that patriotic backdrop, to try to create images that I'm sure we'll see in a campaign ad soon enough. You know, at a moment where right now his team, they can't schedule rallies. There are none on the books because of the coronavirus surge. They're not sure how they can handle that, but this is a moment they feel like can make him look presidential, try to have an image that can attempt to turn his fortunes around to begin that quest 4 months until Election Day.
Dr. Hotez, Texas has 182,000 cases, 2,562 deaths on record. What's your gut tell you about how much worse this is going to get before it starts to get better?
Yeah, some of the projections are pretty dire. The models coming out of the University of Pennsylvania show, as bad as things are in Houston right now, for instance, those numbers could double within the next 2 weeks and then double again by the end of July. So we are on this steep acceleration, and especially in the metro areas, Austin, San Antonio, Dallas, Houston, but now some of the rural areas as well. The governor, Governor Abbott, has now taken some firm measures, mandating the use of masks, closing the bars, putting restaurants at 50% capacity, and some of the county judges are also taking even more aggressive measures. The question is, will it be sufficient, given the trajectory of these cases and some of the predictive models? And the answer is we don't know. It may require us to go back into full lockdown, especially in the big metro areas. Yeah. And I think that may actually have to happen. But if we have to make that decision, we'll need to make it soon.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.